So here we are celebrating the final day of our Clinical Research Awareness Programme for nurses, midwives and allied health professionals.
It's a way that they can dip their toe in the water of research and be involved in clinical research delivery.
Is to raise awareness within the clinical teams that are out there that may not have had that opportunity before.
The Clinical Research Awareness Programme is a 12-week funded programme designed by North East and North Cumbria's Learning and Development team. It includes a wide range of blended learning activities including attended classroom sessions, workplace placements, access to a dedicated mentor, as well as self-study. The programme is supported by an online virtual learning environment, or VLE. A VLE allows delegates, facilitators and administrators to access a wide range of useful online activities and course functionality, such as a programme event calendar, a glossary of clinical research terms, local clinical research network induction e-learning, discussion forums set around structured topics, course announcements that are sent automatically to delegates' email addresses, and a personal learning journal that allows delegates multiple ways to record their reflections. Feedback from the programme has been very positive.
My next step is to be actively involved in research. I've been able to have an opportunity to go on different placements.
This course has enabled me to kind of look left and right a little bit. So I'll be looking for future courses, something like a diploma or perhaps even an MSc, but certainly being involved in more research.
The Learning and Development team are evaluating the VLE and hope to incorporate this approach into other courses. The team would also like to develop social learning activities that utilise online discussions and group activities from within the VLE.
My name is Christine Huntley and I'm the Business Intelligence Analyst for the North East and North Cumbria network, and our showcase is real-time PRES data.
I'm Justine Smith, I'm the Senior Strategic Manager here in the network in the North East and North Cumbria. I also lead on continuous improvement and I lead on the patient public involvement and experience work. With PRES, which is a patient research experience survey, we wanted to look at the way that we involve patients in research and what service we provide to patients in research studies. So we take part in the questionnaire that we improve year on year to see what we can do to improve our service when patients are approached about taking part in research, and also what their experience of being part of research was. But with our continuous improvement work that we do here, we want to be able to make that a real valuable data set that we can use and not just a tick box exercise. And I want to be able to see that data in real time so that we can actually improve the service in real time.
So we decided the best platform for the PRES data was the Open Data platform. So we have launched PRES data in our app, in our local app, and it's real time pretty much, so it refreshes every day, and anybody who has an interest in the PRES data can view the data on there by trust and by study.
So, what are we doing in the North East and North Cumbria to support the NIHR's digital strategy?
I guess this really is the elevator pitch. So for patients and members of the public, we're using social media as a way of significantly increasing our audience reach. By partnering with Voice, we're giving people in our region access to an online platform that allows them to debate and to shape the research agenda. Our online patient research experience survey gives us the opportunity to hear from participants just what it's like to be part of one of our studies each and every time they have contact with one of our studies. For chief investigators in our region, you get automatic access to a range of online tools to help with end-to-end study management. You'll get access to online feasibility and enhanced performance monitoring and management. You'll also get access to a range of communications channels which give you the opportunity to share the findings, the results and the impact of your research. But most importantly, they also give you the opportunity to say thank you to the people who have supported your research, either as a participant or as a participating site. And finally, the primary research that we have conducted with patients and members of the public around data sharing preferences and consent for contact mean that we are ideally placed to join the debates, the discussions and the decisions around data donorship. So in the North East and North Cumbria, we're using digital technologies as the way of improving the services and the support and the offerings we make to our patients and public, our health and social care practitioners and the wider research community.
So, digital technologies in the North East and North Cumbria. Going up.
The NIHR Clinical Research Network, along with our partners in Scotland, Wales and Northern Ireland, are changing the way we capture research activity data. We have been capturing research activity data, often referred to as recruitment data, in our central portfolio management system using a manual spreadsheet upload since 2005. However, this is all to change when a new way of collecting research activity data is delivered across the UK, delivering benefits to researchers, industry, the NHS and the public. In the new way of working, researchers and research support staff across the UK will continue to recruit participants into their research study and will capture this research activity data in their local portfolio management system. The data will flow from the local portfolio management systems across the UK into the central portfolio management system on a daily basis. To ensure that the data we hold for a study is correct, each month the Chief Investigator or their nominated representative, or a representative of the commercial sponsor or CRO, will log in to confirm that the research activity data we have received into the central portfolio management system is accurate. A process for confirming where data is inaccurate and for this data to be corrected at source in the local portfolio management system will also be supported. We have designed the new process with input from researchers, support and network staff across the country to ensure it is easy to use. This new way of working will see many benefits, including a unified way of capturing data across the UK, where research activity data will be captured only once in the majority of cases. Reducing duplication of effort and disharmony between systems will free up time for staff to focus on research delivery. In the majority of cases, the Chief Investigator, or their nominated representative, will no longer need to manually upload a spreadsheet into CPMS. Instead, each month, they will be able to confirm the accuracy of their research activity data directly in CPMS. Additional recruitment data points will be captured, providing a more granular understanding of research delivery. The move towards near real-time data will enable proactive performance monitoring and targeted study support, ensuring we can improve the delivery of research to the UK public. So what will the new way of working mean for you? If you are a member of research staff recruiting patients into trials, you will continue to capture this activity in your local portfolio management system. This should be captured as soon as possible once the activity has taken place. If you are a Chief Investigator or their nominated representative, or if you are a company contact and you currently provide research activity data to the Clinical Research Network by spreadsheet each month, you will soon be able to confirm this data directly in CPMS via our user-friendly screens. Look out for communications about training and about the project go live.
The idea for the festival came from the frustration that there were certain stories being told about dementia, but not necessarily a well-rounded story. We were hearing a lot about decline and loss, but that wasn't necessarily representative of the stories that I was seeing and hearing on a daily basis here at the Playhouse, where people were being creative, they were finding friendship and laughter and fun, and they were taking new adventures in the face of a really challenging condition.
One of the big rules about this is there are no wrong answers. Freedom! Open space!
Oh, it's been absolutely brilliant. Everybody has a chance to say what they want, do what they want. And if they say it wrong, it doesn't matter.
The Playhouse has pioneered dementia-friendly performances, so they started in Leeds and have been adopted by loads of theatres across the UK and further afield. And so the Every Third Minute Festival is a chance to showcase that work Not just the work we're making, but also other great artists and companies who are making work.
Why have I a bad memory? I had a good one yesterday. Where did most of my memories go? Why did they fade away? Why, I ask and I still remember memories as a child, but ask me what I did last week, my brain will just go wild.
I thought dementia was a real degenerative disease, and you couldn't remember things, couldn't do anything, and to see him being so creative and explaining how he feels within his poetry, it was just totally moving. It was really beautiful, really beautiful.
I was really moved actually to see such young people like expressing what it's like to have dementia. It was really informative and actually quite funny at times. So yeah, I enjoyed it.
It's been an incredible experience of learning, and it has proved again and again how capable people are, how resilient they are, and for us to learn from that can teach us a lot about our theatre practice and also makes sure that we are as welcoming and supportive as we possibly can be.
I hope they got a better understanding of what it's like to live with it. There's good moments and there's bad moments. You just carry on. You've got to have hope. If you haven't got hope, life's not worth living.
We trialled Conversation Starter at an engagement event for our research workforce. The software allowed attendees to specify the kind of networking connections they would like to make before the event, letting them share their expertise and interests. Conversation Starter then created personalised networking schedules to set up networking opportunities between like-minded people. We found that attendees really valued the tailored networking and there was a real energy in the room. Having been successful in securing funding from the small grant scheme, we're now looking to taking networking to a new level. Here's Steph to tell you more.
My name is Stephanie Kings-Jones. I'm the Learning and Development Officer for the Clinical Research Network East Midlands. We will be using Conversation Starter for the Research Forum event, which is our event that we hold for the researchers every year. Sometimes I think people are nervous at events to network with each other and may not know how to start up that initial conversation, and Conversation Starter is going to actually help them to do that because they'll be able to do keyword searches on their research interests.
thrombolysis to the resus ETA 8 minutes.
Okay, that's good. Just look at my nose for me, please. Just tell me which hand those are pointed at.
Right. Left.
Very good, thank you. Excellent. Let's review the image in this case. We need to be as quick as possible about it. I need to make a decision to thrombolyze this patient or not. Do you have the criteria for whatever study you think the patient might be eligible for?
Okay, so I'm thinking this one will be a good ECAS-4 one, so we look at extending the time frame for thrombolysis. Okay. Let me just have a look here.
And of all the studies that we have, that's the best one. There are so many, it's hard for me to keep track of.
No, yes, this is the best one for this.
Excellent, excellent. Right, let me have a look.
So for the imaging criteria...
Yeah, for the perfusion imaging, please, what would the criteria be for that?
Oh, I'm really sorry, I know I do have it here, just give me a moment.
That's right. As quick as you can, please.
So in general, we have quite a wide range of studies that we run here, and it means that we require quite extensive amount of paperwork that we have to carry around with us when we have to refer to information for inclusion into the trial. So instead of carrying loads of clipboards and big files, it's better just to have everything on your mobile phone, and you can access it anywhere in the hospital.
Right, very good, thanks. That's a total NIH score of 12.
Okay.
What do you have?
So we need a range between 4 and 26.
Excellent, excellent. So it looks like you're having a stroke, unfortunately. Because of the time frame that we're looking at for thrombolysis, you've missed the 4.5-hour mark for thrombolysis. But we have a study that we're running here that looks at thrombolyzing people out of hours. Is it something you might be interested in?
Yeah.